Your industry or your field of medicine has evolved so much that I feel literally and so proud today with the kind of work you have been doing and your industry has been doing. So kudos to you on that.
Yeah, thank you so much, my dear. Yeah.
Right. So talk to me a little bit about your journey, doctor.
So I completed my MBBS. That was in 1998. And then after that, I did everything. All my education was in Kashmir, my post-graduation. And then after that, we just came here to Dubai in 2006. And since then, yes, I've been working here as a specialist OB-GYN. And alhamdulillah, it's good. I love Dubai. It's a nice place. And I started working in Bilhol European Hospital. My first job was there, and I worked there as gynecologist for 12 years. And then then I had the privilege to join Prime, and Alhamdulillah, now I'm here working in the Prime Al Barari Medical Center.
Right. One question that I have to ask you is what is the difference between a gynecologist and an obstetrician? We've been reading about this, but we have no idea.
Yes, it's the same term. Obstetrics is regarding childbirth, and gynecology is regarding all the other conditions of a lady, menstrual problems. Like there is so much of other lady problems and all. So it's basically a combined term, obstetrician and gynecologist. You cannot be a gynecologist alone, and you cannot be an obstetrician alone. When you are, it's a full package.
Oh, interesting. Now tell me something, doctor. When should a woman actually come and visit a gynecologist or go and visit a gynecologist? Because we hear the term, yes, we know it is, for women, women's health, but somewhere we also take a setback when it comes to, going and looking
Yes,
after ourselves.
yes,
So talk
yes,
to me a little bit
exactly.
about this.
So the first thing that I want to tell you is that you do not need to be sick to visit a gynecologist. So especially when you're married, and you can always have a checkup with your gynecologist just to check up for your uterus and ovaries, like the basic kind of stuff. Young ladies and all, if they have like normal periods and they don't feel any problems in their uh, any abnormality they see, then it's not necessarily that you go to a gynecologist. The gynecology is usually supposed to be like a taboo, that you don't send unmarried girls, and that you wouldn't take them to the gynecologist. So, but yes, nowadays we have a problem that many young girls and teenage girls, they suffer from irregular periods.
Right, right.
So, and you believe that it's going to get settled on its own. But I would suggest, especially for young girls, I would suggest that, yes, you should take them to a gynecologist. Of course, they're not going to examine them, but there are other non-invasive measures just by consultation and by hormonal examination. We can do an ultrasound from abdomen, and we can find out if they do have some condition that can be treated and taken care of.
Right. And one of the common conditions I think most of the children have these days is PCOD, right? Because of the
Yes,
weight,
yes,
and that leads to irregular menses as well. So talk to us
yes.
about how important is it for these children or for mothers like us as well to understand the the gravity of the situation and kind of voluntarily take our daughters to the gynac,
Yes,
because
yes, yes.
sometimes we want to shy away because who will think what
Exactly.
if
Yes.
someone thinks
Yeah.
otherwise, and there are so many other
Yes,
ways
exactly.
that
Yes,
you can
exactly.
counter it.
Gynae is like you will take the child to the physician, you'll take the child to other specialties, but for gynae, usually you do not want to take your child. So this polycystic ovarian syndrome, yes, this is very common, and especially young girls, especially in Dubai. I saw it from my past 16, 17 years. I saw that, yeah, young girls having irregular periods there. So this polycystic ovarian syndrome, it is one of the most common endocrine disorders that has been seen among young teenage girls and young women. And this basically in this condition, there is the ovaries, they start producing an excess of androgen. But because of this excessive amount of androgen, it can interfere with the development and release of eggs in the ovaries. Every cycle there is ovulation happens. All of us know about that.
Right.
So instead of a mature egg being released during ovulation, tiny fluid-filled sacs develop in the ovaries, and which has the name, we call it as polycystic ovarian syndrome. But this thing does not end up at this stage only having the polycystic ovarian syndrome. It's a kind of metabolic syndrome. It's not taken care of. So the ladies, they can get weight gains because of the hormonal imbalance. They can have weight gain, obesity, difficulty in maintaining a normal weight, especially around the abdomen. Then they can have excessive growth because of this hyperandrogenemia. They can have an excessive growth on hair growth on the face, chest, abdomen, and back, depending on the severity of the condition. But the key sign in young girls when they are very young is irregular periods and or missed periods. The periods can occur at an interval of 35 days to 6 months, or less than 9 periods per year. If your daughter has, you should get a gynae consultation, I would suggest.
Right. Now, doctor, tell me, in fact, educate me on this subject. Now, my understanding is if a child, is of age, comes of maturity a little earlier, because you also have children at the age of 9 attaining maturity. Does that mean menopause is on cards a little earlier for them?
No, it's not exactly like it. That's what they say. No, not exactly. But yes, these girls will be, if you have an early like menstrual cycle starts and late menopause, the only thing is that they are more exposed to the hormones, that is estrogen. So that's a totally different kind of scenario in which we say that if there is excessive estrogen exposure to the ladies, then they can have chances of breast cancer are more, endometrial carcinoma, like the effects of the estrogen on the body. But as such, the term, because always the people tell me, like, when they have irregular periods, they say that, doc, I started my periods very early. So is this menopause? Like, I have ladies coming at in late 30s or early 40s. Right. They tell me that, am I going to have a menopause? I said, no way. Nowadays, like with good lifestyle and, I have my patients, they have menopause. Minimum I have seen like 52, 53 really. I have very less females who have a menopause before the age of 50. So I would suggest till 50, you have the years of youth still going on. So don't think about menopause at all. Right. But of course, if you miss your periods, you need to, rather than thinking that you have, it could be perimenopausal or menopause, you should go visit your gynecologist and see how it is. And then we do have measures to check, non-invasive measures, I would say, like blood tests, hormonal profile, and then we also have the ultrasound examination, which can just tell us the condition of the ovaries, of the uterus, and we can say like how things are going on.
Right. Also, doctor, there is this concept, right? The moment you're 30, pregnancy becomes difficult. Now, this is something that has been instilled in us time and over again, and and the force of of natural birthing is becoming very common these days. Like, everybody only talks about natural birthing. No one really gives C-section another thought. Firstly, I want you to address, is it difficult to get pregnant after you are aged 30?
No, not at all. Not at all. That was a term that, yes, once the girl turns 20, she should be like, she should find a match and then she should have babies. No, not at all. I'm just, not to speak of books and all, I have been working here for more than 16 years. And most of the people in Dubai, they are hard-working females who are career-oriented, and most of them become pregnant, after 32, 33, they plan a pregnancy. So no, I don't think so. It should be due. But of course, there is the time takes. We always say that by 35, at least 35 years, at least plan one baby. There are chances of having congenital malformations in the baby. That is the term. Difficulty in getting pregnant. Of course, the ovulation and all might not be so good as it was in your 20s. But yes, you will be able to become pregnant. There should be no problem at all.
Right.
Talk Music, brought to you by insurancemarket.ae.
Love is in the air, everywhere I look around. Love is in the air, every sight and every sound. And I don't know if I'm being foolish, don't know if I'm being wise, but it's something that I must believe in, and it's there when I look in your eyes. Love is in the air, in the whisper of the tree. Love is in the air, in the thunder of the sea. And I don't know if I'm just dreaming, don't know if I feel safe, but it's something that I must believe in, and it's there when you call out my name. Love is in the air, love is in the air. Love is in the air, in the rising of the sun. Love is in the air, when the day is nearly done. And I don't know if you're illusion, don't know if I see it true, but you're something that I must believe in, and you're there when I reach out for you. Love is in the air, everywhere I look around. Love is in the air, every sight and every sound. And I don't know if I'm being foolish, don't know if I'm being wise, but it's something that I must believe in, and it's there when I look in your eyes. Love is in the air, love is in the air. Oh, 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 oh. Love is in the air, love is in the air.
InsuranceMarket.ae now has over 20,000 Google reviews, the highest rated and the largest insurance platform in the country. InsuranceMarket.ae.
This is Talk 100.3.
Tired of the hassle of car ownership? Finding the long-term commitment involved in car rental difficult? Subscribe a car with Subscribe Me, your subscription app for car freedom. Download the Subscribe Me mobile app for quick and easy booking process. Track all your transactions and invoices seamlessly. Put the power of choice in your hands. This World Cup, use the exclusive promo code ICCBIG55 to avail fantastic discounts. TNCs apply. So, what are you waiting for? Download the Subscribe Me app now. Register and unlock a world of convenience.
Barari Sony Events Management presents Honor Bullion Navratri 2023. तुषार सोनीग्रा और उनके ट्रुप के साथ from 15th to 24th October रोज रात 9:30 बजे से एतिसलात एकेडमी दुबई में. Season pass 250 dirhams and daily pass 50 dirhams per person. Children under 7 enter free. Honor Bullion Navratri presented by Purushottam Kanji and Company, powered by Sugandha Jewelers, supported by APM Capital and Kanj Jewelers. Media partner Khaleej Times, official airline Air Arabia. जीते गोल्ड coins from Honor Bullion और भी prizes हर रोज. Tickets available at Harshat Trading Dubai, Honor Bullion Trading Sharjah, Imperial Jewelers Sharjah and Satyam Jewelers Dubai. For info, call 050-6979-317. Event made large by Big 106.2.
Mamma Mia with Muriel Desar. Talk 100.3.
And doctor, talk to me about natural birthing and also C-section. Now, the reason why I'm asking you is, as a gynaec, as a doctor, you would be in a better stance to take a call on the two, to talk about the pros and cons, for, or maybe help us understand the functionalities of two, if I opt for a normal birthing or if I opt for a C-section, just in a given situation.
Mm-hmm. It's not that we opt for normal birth or cesarean, because when the patient is pregnant, once they are at the end of 9 months, we call it like around 39 weeks, 38, 39 weeks, we do a vaginal examination. We need to see that if the birthing passage is adequate for the baby to come out. If the birthing passage is adequate for the baby to come and there are no other contraindications, normal delivery is the best and the only process that should happen. And if it is if there are any contraindications to normal birth, or there are any complications occur during the process of labor, only then we will opt for a cesarean.
But doctor, going to a gynecologist, I mean, the thought of it sometimes is a little overwhelming, because it's a very personal journey, right?
It is.
And especially if you have
100%.
to go with your mom to the clinic, or you have to go with, with any of your relative, you feel a little overwhelmed, because one, it's your personal journey and you don't want people to know about certain things. So talk to me as to how should we parents address going to, taking our children to doctors, taking our children to a gynecologist, and kind of building that rapport with them, so that in the future, if they can't deal with us, at least they can talk to the doctors.
Yes, my dear, yes. About young girls, whenever young girls come to a gynae clinic, the approach is totally different as compared to when we deal with our, other females who come for a checkup and all. So it's only about taking the history, and we are very careful about talking to the young girls about whatever history we take and all, and then we don't go for an examination straight away, especially. So it's all just about the history, and then we do an abdomen, just a palpation from the abdomen. We're not going to do any procedures at all. And we do an ultrasound from the stomach. So I do not think there should be any problem at all. And we are very careful when we talk to young girls in front of parents. But I have seen these days lovely mothers who are very frank with their girls, and they are the ones who bring up the questions. Please, doc, can you advise? But especially I have girls who have to go for studies abroad, and it's very welcoming that I have lots of mothers getting their young girls just for counseling to the gynecologist and to check about the hormones, and they just tell me that yes, could you just check her CBC, or about the complete blood count, or about the menstrual pain. And yes, and I have counseled lots of young girls. I think there should be no harm at all, and no gynecologist is gonna ask those weird kind of questions to the child. If we deal with them like they are kids, even if they are 17, 18, 19 years old, they're still like kids. So we treat them like kids, but of course in a grown-up young ladies. So we talk to them in a very in a shielded manner. Yeah, of course.
Right, perfect. Doctor, one last question. We're running out of time. You've been fabulous with all the information that you've put across. Now, before you leave, I want you to stress on the fact of having a complete nutritionist diet. This just to ensure that our girls are well looked after, so that they don't have any sort of an imbalance in the future.
Yeah. So I would just endorse on this that even if the ladies, they have irregular periods, for example, the young girls, they have irregular periods, the first line of management for young or any other adult who has these irregular periods and all, the first line management would be lifestyle modification. So this would include a healthy diet that is a well-balanced diet, I would suggest, rich in fiber, avoiding refined carbohydrates, processed foods. So the diet should have enough of vegetables, fruits, proteins. So, and in addition to this, a consistent exercise schedule will lead to effective weight loss. And we have seen this weight loss approach is comparable to or better than treatment with medication. So even if you're apprehensive to bring your child to the gynecologist, just taking care of these measures is going to help. Try to avoid those processed foods and all. It's very easily available. So I know we cannot avoid it completely, but you can just keep it to the weekends, or that should help. And when you're at home, try not to bring those confectionaries and all. It should be like a treat. It should not be a daily thing in the house. When you buy bread, it should be a whole wheat bread. And other things, fill your refrigerators with fruits, vegetables, nuts and all. So it should help. And a consistent exercise schedule should be there, like an activity. You don't have to really go to the gym and do it. And the weather is quite hot, so you cannot go on walks and jogging outside for most of the months in Dubai. So there are very easy these plans on YouTube. You can put on 1 mile walk, 2 mile walk. You can make it a fun activity with your child, and you can just run, and it does work. It does work. Any cardio activity, in any running or jumping in the room that gives you sweating and increases the heartbeat, it does work. It increases, and it has a good effect on the metabolism as well.
Thank you so very much, Dr. Munima. It was an amazing session that we had with you. Thank you so very much,
my dear.
Looking forward to now seeing you in person and having those elaborate chats and helping the community in building it, building it up and also making it healthier for all our children.
Thank you so much, my dear. Thank you.
Well, that was Dr. Munima. And yes, you've listened to Mamma Mia with me, Muriel. I'll catch you tomorrow on this very show. Make sure you are tuned in to Talk 100.3.
This is Talk 100.3.
The closer you get, the better you look, baby. The better you look,